First, I would like to ask you permission to use this video for educational purpose and on internet.
Yes.
About 2 years ago, we did a spine fusion for you, correct? A
Yes.
minimal invasive OLIF. First, tell me what were your symptoms before that surgery and how were you after that surgery?
My symptoms before the surgery was intense lower back pain. I just really didn't have any quality of life at all, and we just kept thinking, it would just go away. It was sciatica or whatever the case may be. So then my primary doctor referred me to you, Dr. Abbasi.
So what did we do?
You did surgery on we went through a series of things, physical therapy and things like that to see if it would get better, which it didn't help. We scheduled me for surgery in November of 22. And
So about 1.5 years ago.
yeah, about 1.5 years ago. And then
What levels do you remember we do the surgery?
I think it was these two
Yes,
right
the
here.
bottom two discs,
Yep.
L4, 5, L5S1. Was the surgery done here?
It was done here at Riverview in
How long,
Crookston.
how long did you stay in the hospital?
I had quite a bit of pain afterwards. I want to say that I had the surgery on a Thursday, and I want to say I went home on a Sunday.
Okay, so actually I have the record of the surgery right here. My note says as well that we did a discogram because you had multiple bad discs,
I
but the
did.
discogram showed if we fix these two, we have done enough.
Yes.
And my surgical note says that your surgery was 77 minutes, and my note says you stayed 2 nights in the hospital. Is that
Okay.
about right?
That's about right, yeah.
Okay. Well, our blood loss from that surgery was 1/5 a cup of coffee, 72 cc.
Okay.
So, what did you notice right after the surgery?
Well, I had a lot of pain after the surgery, but my middle of the back pain was no longer there. However, then I seemed to have like a sciatica type pain, and then they first tried, they gave me a round of prednisone to see if they could get the swelling down. That did help some. I went through physical therapy, and then I got a little better, but then it started in again where it was more of a sciatica pain and this intense stiffness on this side, and it prevented me from being able to do things. And so I should have just went on my chart and contacted you sooner regarding the injections, but I waited till my appointment, and that's when you explained to me that it was probably coming from the SI joint.
Now, what we noticed then that this pain was different than your previous pain. Is that correct?
Absolutely, yeah, it was different.
It was different. So, we know that almost half of the people who have spine problem have as well sacroiliac joint problem. When we saw you finally, we noticed that the previous pain from the surgery more or less was gone, and this was different.
This was different. This was definitely different.
And then what we did is we sent you for injections. So tell me, what was the result of the injection?
So I went for injections about a week and a half ago, and I actually went in not expecting anything because I've had back injections before that didn't work. I had improvement right away after she did the injections.
Who did the injection?
Dr. Aya.
Okay, well,
She was amazing.
Dr. Aya, here, she says you were amazing.
You were absolutely amazing. And I have had that sharp pain went away, and as I continue with physical therapy, the stiffness has gone away now. I walk with more confidence. I've been able to take the stairs much better now, and I've been able to lift and carry things like groceries in the house. It was difficult for me even to do that because of that pain that I had in my back, and the stiffness I had prevented me from doing normal activities around the house, and now I've been able to do all of that stuff
No,
again.
and that is very important information because you are allowed to have more than one problem.
Yeah.
And look at the lower disc and the sacroiliac joint are so close. We do the surgeries. Most of people can say, it's different, but it's the same area, but it's different.
Right. It was different.
And then we fix one, but the other one is still a problem, and we have to fix two things before you get where you will want to be. And
Right.
it seems that, the first surgery helped, but you had additional problem. And now that injection proved, number one, that this is the problem. Number two, the injection was a few weeks back and the pain is still gone.
It is still gone, yes.
So what do you understand what the next step should be?
The next steps I'm doing is making sure that I do my exercise and strengthen those muscles in the back.
Physical therapy and
Physical
exercises,
therapy
yeah.
and doing exercises at home and just staying active.
And no
walking.
injection only if needed.
Yep.
So how much of the pain is gone after the injection?
90 to 100%. I mean, I
Okay.
really don't have any pain back there.
Then
I get a tired feeling if I walk too far, but that's because those are muscles back there I haven't really used or exercised in a long time because I had all that sciatica
So then
pain.
now we can say, good job, Dr. Aya, right?
Good job, Dr. Aya.
Okay, thank you so
You're my
much.
new best friend.
Thank you, I appreciate that.